of the most difficult behaviors that you may find with your loved one is agitation or aggressiveness. And that certainly can be troubling for you as the caregiver, and it can be frightening for the loved one experiencing the symptom of dementia and that behavior of aggression. One of the first things I encourage caregivers to understand is what triggered this behavior. That's the first thing you should always ask yourself when your loved one experiences agitation or aggressiveness. One of the biggest reasons that a loved one with dementia may experience aggression or act out. One of the biggest reasons is a change in their caregiver, a change in their environment. That's why we see oftentimes when someone goes to the hospital, or maybe they have had a change of caregiver, that they may act out. And that is certainly one of the biggest triggers, is that change in environment. Another thing that we see that is very common is an acting out of aggression or agitation when being asked to bathe or change their clothes. And that's certainly, a very personal experience. And so, I encourage you as a caregiver, put yourself in that person's shoes. How would you feel if someone began to undress you or tried to assist you with something as personal as a shower? And so that is often an opportunity for you to learn what your loved one may be going through internally. Is that, this is the ultimate issue when it comes to independence, is personal care. And so oftentimes we see that aggression during those attempts with personal care. So those are some of the triggers. So what I want to give you some, encouragement is that there are things that you can do to try to lessen the aggressiveness and try to understand maybe what's causing their frustration. I think first and foremost, as the caregiver, provide reassurance to your loved one that they are safe, that they are okay, and also validate their feelings. You can use phrases like, "I'm sorry that you're upset." And, sometimes just beginning your response with the words, "I'm sorry," that deflects some of the attention off of them and puts it kind of back on you, where you're sort of taking the blame almost for their behavior. "I'm sorry that you feel that way. I'm sorry that you're upset." And you want to provide that reassurance. One of the greatest tips that I can offer is redirection. You may have heard of that term before, and it literally means to change direction, change the subject. And so for your loved one, it may be that you have to stop that task and do something else to calm them down. Maybe a favorite food, their favorite TV show, any activity that that they enjoy. Usually something sweet, ice cream or a cookie usually changes the mood pretty quickly. And so your loved one better than anyone else, and you know what their favorite things are. And so I encourage you to use that tip of redirection. Another opportunity to maybe lessen agitation is to change their environment. Like I mentioned, that change of caregiver or change of environment could be the number one thing that's triggering it. So maybe you need to try to adjust the environment to make them more comfortable, bringing in people that they know and that they love, their primary caregiver. Maybe in a hospital environment, there are things around that are beeping, things that look scary, and maybe some of those items need to be removed. And so that may be a simple change to the environment that could help reduce that agitation. Sometimes it's the visitors. It could be a barking pet. It could be the television that's on. All of those things could be a stimulus to increase agitation. It could be you as their caregiver that's causing the agitation. And sometimes that just leaving the room and coming back in 5 minutes later can certainly help reduce that agitation. So it's difficult. I get it. It's so difficult. What works today may not work tomorrow. We encourage caregivers, try a couple of different ways, 2 or 3 different tactics, and just keep trying. It can be difficult when you're dealing with agitation and aggression. And if you can try to help your loved one feel like they still have control and that they have as much independence as possible, that's really at the root of it. Probably the number one reason why someone acts out with any behavior with dementia is control. And so help them feel like they're in control and give them choices, give them as much control as possible. And that will certainly help, limit, maybe minimize the agitation and aggression that you're experiencing.